If you struggle with dry and brittle nails and have rough cuticles, then you do not want to miss today's video. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. Today, we're talking about nail tips, in particular, how to treat and prevent dry and brittle nails, nail prone to breakage, splitting, as well as rough cuticles. And I also touch a little bit on why sometimes our nails get bumpy and have ridges, because these are really the most commonly asked questions I get asked by my patients in clinic, as well as by you guys on social media. Nails definitely don't get as much attention as they deserve, and we definitely don't talk about nail care as much as we do skin and hair care. And I get it. It's often not the first thing people notice when they meet or see someone, but nails can serve as a very important clue to our overall health, and the way they look and feel can greatly impact our physical well-being as well. It's so common that I have patients come in to see me in clinic concerned about just even one nail that is discolored, thickened, and they are so motivated to have that addressed. So the overall health of our nail can definitely greatly impact our overall well-being. Now, before we talk about the common causes of nail concerns, mainly dry and brittle nails, and how to address that, and not to get too sciencey on you guys, I do want to give a little overview on nail anatomy. I think understanding the basics of nails will help you guys better understand why, as dermatologists, we frequently talk about things like moisturize your nails, avoid water, and don't pick at your cuticles. So I like to say nails and hair are cousins in the sense they have a lot of similar structure, predominantly keratin protein. They're both essentially dead non-viable tissue, but certainly dynamic in their own ways, and they also do come from similar origin. And it's very interesting because of that. Certain dermatologic conditions that affect hair can affect nails and vice versa. So when we look at the nail, we actually call it in dermatology the nail unit. That describes not only the nail, but also the surrounding tissue, vessels, and nerves around the same area. So when we talk about nail here, the nail plate, the hardened tissue that we commonly refer to as nail, that essentially just a dead keratin tissue. It's laminated keratin that has hardened and basically serves as a protective covering of the nail bed, which is the skin underneath it. And in that nail bed, you have a lot of important nerves and blood vessels, and right beneath that is bone. Surrounding the nail plate, you have nail folds on the sides, and then the proximal nail fold that we commonly refer to as cuticles. Now, when you look at the nail, there is this kind of half moon shape white area, and that's called the lunula, and that is kind of basically where the distal nail matrix is. The nail matrix is basically a place where we have nail stem cells that is what's constantly generating new nails. So you have the distal nail matrix that we can kind of visibly see, and then the proximal nail matrix is where the nail fold or where the cuticle is. And your nail grows like this, where the proximal matrix is responsible for growing the nail on top, while the distal matrix is responsible for forming the nail on the bottom. And this is really why, as dermatologists, we say leave your cuticles alone, don't trim it, don't push it, unless you really have to, because that cuticle is really an extension of your proximal nail fold, and it's meant to form that seal, that protective barrier. Once that seal is gone, this is where bacteria, mold, fungus, other irritants can get in and cause inflammation of your nail fold, and the medical term is called perionychia. And that inflammation will actually affect the overall health of your nail as it's growing, as well as cause ridges in your nail. So when you notice there are ridges in your nails, that's often due to mild inflammation, because that cuticle is no longer there to serve as that protective mechanism. And when you do get insults of your cuticles, leaving ridges on your nails, for the most part, they are temporary. It will get better as it grows out. And not only do we see this with like local trauma to the nail unit, we actually see this in illnesses too. And this is kind of going back to what I was saying earlier. Your nails can be clues to your overall health. There is a term called onychomedesis, where there's actually proximal, so separation of the nail plate from the nail bed. We see this a lot. We've seen it in COVID. severe viral illnesses, it's something that we actually commonly see in kids, and it is temporary. You will see it become more obvious as the nail grows out, and then kind of asking patients or parents like, what happened a few months ago, and they're like, oh yeah, my kid got really sick, and then we just reassure them. We talk about how to care for the nail, but just understand that usually that will grow out, and then the new nail that grows in is normal. That is usually the case unless there is repeated trauma or injury to the cuticles, to the nails, that could lead to permanent damage, because usually that means the nail matrix where the stem cells are so damaged that it's gonna just leave permanent marks in the nail each time the nail grows. Speaking of nail growth, it takes about 6 months for our fingernails to grow from the proximal to the distal end, and about 12 months for our toenails to do so. And this number is important because whenever you're treating like any sort of nail concerns or say inflamed cuticles, I always have to tell my patients, like, you will start to notice a little bit of nail abnormality coming through because kind of that trauma occurred now, and it's going to basically just is a mark in your nail plate, and that will be reflected later as your nail is growing out. But once that inflammation, that injury is reversed, your nail plate should not continue to look abnormal. So it's kind of like leaving that mark in time. And similarly, when it comes to treating toenail fungus, the fungus affects the nail plate, but the nail plate is dead. So we really cannot, aside from removing the nail plate, do anything to the nail plate. So when we're treating, and especially like taking oral medications for nail fungus, what we are really doing is impacting and reducing and preventing the new nails that grow in to be infected. And that is what I tell my patients. You should be noticing that as the new nail grow in, it should look normal, not thickened or discolored. So let's talk about some of the common causes to dry and brittle nails. First and foremost is just hand hygiene. Our nail plate, because it's just dead keratin, every time we subject it to water, when we're washing it and then drying it, that wetting and re-wetting process really damages the nails and causes the nails to be more dehydrated, and then over time causes dryness and brittleness. Other things include like nail polish, manicures, and all those things. Essentially what you're doing, you're thinning out the nail by filing down your nail when you're doing gel manicures, and then with acetone, when you're removing nail polish, it dries out the nails as well. And then with the gel polish, it's not so much easy to remove, and each time you're removing, you're filing it down. So basically you're just taking down layers of nail, making your nail thinner and therefore more prone to breakage, splitting, and damage. Other common things, like if you're a nail biter or you are in habit of like playing with your nails, what we call habit-take nails, or using your nails as tools. And then certainly there are other medical conditions that can affect your nail health. Some are genetic, some are like common things, for example, eczema, psoriasis, and lichen planus, aside from nail fungus, that is more of an infection, but certainly can affect the looks and the overall integrity of your nail. Fungal nails can sometimes be very thickened and have a lot of debris and crumble very easily. And lastly, certain types of nutritional deficiency, more commonly like iron and zinc, can affect the overall health of your nails. And then lastly, kind of what I was talking about earlier, your cuticles, the overall health and the state of your cuticles. If your cuticles are constantly inflamed and not healthy, that is definitely reflected in your nails. At the very least, it's going to cause ridging and bumpiness of your nails, and certainly long-term inflammation can affect the thickness and the integrity of your nail plate as well. All right, now let's talk about nail care. Starting with the basics, I always recommend everyone to keep their nails short. And a good length, I tell people, is when you look at your hands this way, if you can't see your nails past your fingertips, that is an ideal length. When they're long, they're just, number one, more likely to break and chip. And two, when they're long, we tend to use them as tools, right? Like opening a soda can, for example. And three, when they're long, they are more likely to damage our skin. I see patients all the time with eczema, and they're just scratching the heck out of their skin, sometimes unconsciously at night. And when their nails are long, it's way more likely to damage skin. And actually, a trick I tell my eczema patients is always trim your nails short. Keep them short, so that way, even when you scratch, you really can't do as much harm to your skin when you don't have nails to scratch at the skin. When it comes to nail trimming, just take your nail clipper and cut straight across. And then you want to actually use a nail file to smooth down any edges that are uneven, that could snag on things. And when you are filing, you want to file in one direction. Going back and forth can actually weaken your nail plate and potentially cause more trauma, splitting, and peeling and chipping of your nails. And for nail files, I actually really like glass nail files. I find that they're higher quality and get the job done more effectively without introducing micro tears into your nail plate. And one I really recommend is from Dr. Dana, their glass nail plate nail file. That is really easy to use, and it really helps me to smooth down my nails very quickly without introducing additional trauma to the nail. 2, as I alluded to earlier, don't use your nails as tools that can really chip and break nails. 3, be mindful of your manicures, especially the ones that you get done professionally, and take breaks in between manicures. Gel or acrylic nail manicures in particular, they really are beautiful. They make your nails look really nice, but at some point they're gonna have to be removed. And it's really that removal process that's damaging to the nails. Certainly when you have them, it can temporarily strengthen your nails overall, but when you take it down, you have to file it down. Often that filing process, you are taking away layers of your nail plate along the process. And you probably have noticed that every time you get your nails removed professionally, like the gel manicures, your nails, if you don't do anything afterwards, feel much softer. And that is because to effectively remove like the gel nail polish, you have to file down some of your own nails. And similarly, if you do have like bumpy, uneven, and ridges in your nails, and you are trying to file down your nails, buff it out to make it smooth, be mindful of how much buffering you're doing, because you are essentially filing down the thickness of your nail plate and thereby making your nails softer and weaker and more prone to breakage potentially. 4, protect and care for your cuticles and leave them alone. As I mentioned earlier, do not trim your cuticles. If you have to push them back, it's less ideal, but I think as for the occasional manicure, it's fine. But your cuticles are really meant to serve as a protective mechanism for your nails. And if you are prone to getting inflamed cuticles, one little hack you can try is regular dilute vinegar or bleach soaks that can help at reducing inflammation and bacteria that can get into the cuticles because they're missing and cause inflammation and potentially even infection. And I usually just recommend using white cooking vinegar that we all have at home, or just regular bleach that we use for laundry. And the ratio is about 1 tablespoon of vinegar or bleach to 1 cup of warm water. And make sure it's warm, not hot or cold. And what you would do is soak the finger or fingers in that bowl of water for about 5 to 10 minutes every day or every other day as needed. This is also a hack that can be used for people that are prone to getting toenail fungus, nail infection, as well as like toe web infection. They can do a similar soak for the feet as well that can help reduce, again, inflammation and microbes that can cause problems on our fingers, toes, hands, and feet. Number 5 is always moisturize whenever your nail gets wet. Just get in the habit of putting on a moisturizer each time you wash your hand. I think this is how we can really avoid going down that rabbit hole of having dry, cracked hands. Putting a moisturizer on and making sure that when you are applying that moisturizer to really coat your nail plate as well as your cuticles each time. I really like moisturizers with ingredients like urea and alpha hydroxy acid that can act as great humectants that have been shown to help soften the cuticles and repair nails. For example, moisturizers like the Inculus 10% urea moisturizer is a great one. It's lightweight, does not leave a lot of residue on your hands afterwards. Cetaphil also has a 20% urea moisturizer that's really lightweight and fast absorbing. That makes a good body moisturizer as well as facial moisturizer. But you can just kind of put it on your finger, hands, and nails if you need to. M-Lactin makes a great lactic acid-based moisturizer that I love for keratosis pilaris, but also would be great options for your hands and fingernails. And those ingredients are also really going to be helpful if you are prone to getting dryness and fissures of your fingertips, as well as getting like thickened buildup of dead skin on your hands because of the frequent hand washing and dryness. Just be mindful because lactic acid or alpha hydroxy acid based moisturizers can cause some temporary burning sensation when there are micro tears in your skin. So maybe not the most ideal to use if you actually have cracked and fissured fingertips. If that is the case, then I actually recommend going with urea or petrolatum. I mean, think about slugging. We do this for our face, but slugging can be a great way to instantly soften our cuticles and repair our nails. And you can just even apply coats of petrolatum to your nail plate and cuticles. I try to do this every night, especially in the winter time before you sleep, and you will often wake up with much softer cuticles and more hydrated nails as well the next day. Lastly, consider adding some glycolic acid into your nail care. This may sound kind of crazy, but it's actually a hack that I really recommend using, like that viral trending The Ordinary 7% glycolic acid toner for, or just any sort of glycolic acid based toner. And when it's happening here, glycolic acid being a chemical exfoliant helps to facilitate, that kind of turnover of skin. And glycolic acid is a great humectant to help hydrate. And studies have actually shown that higher strength, and we're talking about like 50 to 70% glycolic acid peels, can help to rejuvenate dry and brittle nails, and even improve like thickened nails that are basically and even help to improve thickened nails that are caused by medical conditions like psoriasis and lichen planus. And we think that is, aside from it being a humectant and improving turnover, it also may facilitate the penetration of other moisturizers and other ingredients that you would put on your nails after, and overall just enhancing that nail rejuvenation process. And how you would do it is basically after washing your hands at night, you would take, for example, that Ordinary glycolic acid 7% toner can either drip some on a cotton pad, or you can put it on a Q-tip for more precise application, and you would just apply it all over your nail plate. And if your cuticles are rough but not cracked or fissured, you can certainly apply it around your cuticles as well. If it is cracked and fissured, then you certainly want to avoid. And what you can even do is like coat the cuticles with a layer of petrolatum, so that way it doesn't get on there and cause burning sensation. And basically you would just let it absorb, and then you're done. I would recommend finishing off with a moisturizer, either urea based or alpha hydroxy acid based, or go and slug with some petrolatum. That really helps to seal all that wonderful goodness in. And if you do this every day if tolerated, but I recommend for most people like every other day or a few times a week, over time it will help to rejuvenate your nails, improve the appearance, make them look more hydrated, and reduce dryness and brittleness. If that sounds a little bit intimidating to you, you can actually check out Dr. Dana has a nail renewal kit that comes with 3 items, basically that glycolic acid nail treatment and a pen that you can easily brush on, as well as a nail buffer that we use afterwards, and then a post-treatment oil that you will brush on. And then you can basically have that whole rejuvenation process already pre-made for you that's really easy to use and can easily follow and do this regularly for nail rejuvenation. And overall, I just love how user-friendly and not intimidating this kit is. And even though the concentration of glycolic acid here is not disclosed in the kit, we're just really relying on it as the active ingredient to promote skin turnover, help hydrate the nail. And honestly, my favorite part of this kit is actually their buffering tool. I love using this to take down any unevenness of my nail plate, any like bumps or ridges, but it does it in such a gentle way. Like the texture of the buffering tool wand is very light, and so that way you're filing down some of that evenness, but you're not going to cause a lot of abrasion and micro tears to your nail plate as you're smoothing it down. Alright guys, I hope you found this video helpful. And one last thing, if you're able to just keep up with regular moisturization of your nails and cuticles, that in it of itself may be enough to keep your nails healthy, less dry and brittle. And one tip I always recommend to my patients is go out and buy small tubes of moisturizers and have them just all over your house, in your bathroom, on your kitchen countertop, next to your computer, in your office, even in your purse. That way you always have them easily accessible. You don't have to walk 2 flights of stairs to go up to your bathroom to put on a moisturizer. So there's really no excuse not to put on a moisturizer, especially after washing your hands. And this will also help to reduce dry hands, cracked fingers that we always get, especially during the winter time. And as you're applying your moisturizer, just make sure that you coat your nail plate and your cuticles at the same time. All right, thank you so much for watching. I would love it if you can give this video a thumbs up and subscribe to my channel. And also let me know in comments below what other nail care products you like, what other nail topics you want me to address in future videos. I'll see you guys next time.